Scientists in South Africa say the new Omicron variant of the coronavirus appears to spread more than twice as quickly as Delta, which has so far been the most contagious. The analysis hasn't been peer-reviewed and the researchers say that there is a lot of uncertainty. Cases are being reported all over the world now, including among fully vaccinated people. The IMF is warning that the variant's emergence is likely to hinder the global economic recovery. Mark Lobel has the latest.
It's spreading right around the world. In South Africa's province most affected by Omicron, officials now say it's the dominant variant, appearing to spread more than twice as fast as the Delta variant. There's over 100 recorded cases in the UK, dozens in over 20 other countries, as day by day it emerges in more. With doubt about how vaccines will react to it, stock markets around the world fell days after it was outed. They've rebounded, but now comes this warning from the IMF.
We are likely to see some downgrades of our October projections for global growth.
Scientists who first identified it decided these mutations were in a class of their own.
It's kind of like a bank robber who the FBI has a picture of. Maybe they grew out a mustache, dyed their hair, and they're always wearing sunglasses and a beard. It's going to be a little harder for your immune system to recognize.
Because of changes to the virus's spike protein, which is the part of the virus that vaccines train our immune response to defend us from. Plus, the fact that
it's spreading like wildfire around the world.
With its spread said to be unwittingly helped by, amongst others, foreign diplomats who flew into Botswana on the second week of November, crowds at the pop band Steps' concert in Glasgow 2 weeks later, and a renewable energy company's Christmas party at this restaurant in Norway last week. But
again, no reason to panic.
Because scientists say the good news is how quickly Omicron was declared a variant of concern after it was discovered. According to the medical journal The Lancet, the earliest known case is a patient in South Africa who was diagnosed with COVID on the 9th of November. Less than 4 weeks on from that, pharmaceutical companies are already working on multiple contingency plans.
One is to rev up the production of the vaccines that they already have. The next is to make, for example, a bivalent, where you have a vaccine against both the ancestral strain and the new variant. And the other is to make a variant-specific boost.
But 10 days since it was reported to the World Health Organization, big questions remain, such as how infectious is it? Does it cause more severe disease? Or could it be a milder variant that takes over, and could that spell the beginning of the end of the pandemic? And on a lighter note, how should Omicron or Omicron be pronounced? Mark Lobel, BBC News.
Doctors in England have been told that they can defer some of the services they provide to patients so they can concentrate instead on delivering COVID booster jabs. Routine health checks for the over 75s and minor surgery could be affected. 75 new cases of the Omicron variant have now been identified in England. That brings the total number in the UK to 134. Ministers have also launched a new campaign urging all unvaccinated pregnant women to come forward and receive their jab. Lebeda Seko has this.
A new life amid the heartache of COVID. This little boy born with the illness and rushed to ICU. His mother had to be intubated. Now she's part of a government campaign encouraging pregnant women to get jabbed.
I was about 32 to 33 weeks pregnant at that stage. When we both got COVID. I had a conversation with one of the consultants on ICU that it would be best to ventilate me just to give my lungs a rest. But my family lived through every day. They lived through the phone calls of being told that, that I may not survive.
When Tanviha got ill in February, vaccines weren't available to her. Now that they are, the government wants all expectant women to get immunised. Nearly 1 in 5 COVID patients in England who are the most critically ill are unvaccinated pregnant women. Of those pregnant women in hospital with symptomatic COVID-19, nearly all are unvaccinated. And crucially, no vaccinated pregnant women were admitted into intensive care with COVID-19 in England between February and the end of September. Meanwhile, NHS England says all adults should become eligible for boosters by the middle of this month as it tries to protect against the new variant.
I got it at the first opportunity I could. I think it's important that everyone gets their vaccine. I think it's important that everybody tries to get it as quickly as possible.
Nobody's confident because we don't know after Omicron what's going to come next. So we just hope and pray that everybody be well.
It's that concern about the unknown which is driving the push to get as many boosters done as possible. And in England and Scotland, the aim is for all eligible adults to be offered one by the end of January. Lebudi Seko, BBC News.